I'm the Medical Center Director. I'm both honored and humbled to be a part of this team that's here today. The people in the around the room are here to give information. This is one of just the beginning of informational sessions that we'll be hosting. And I wanted to talk a little bit of why we're doing it. And also, we hope that the information that you're receiving today will help you to understand and determine, what those things, what the PACT Act can do for you. So when you, or when all of our veterans served our country, you were exposed to many toxic hazards. Things such as, which you'll know about, the toxic air, the radiation, the Agent Orange, the smoke, the burn pits, and there are many other environmental hazards. So we know that for too long, our veterans and the survivors weren't able to get the toxic exposure-related benefits and the health care that you have earned and that you have deserved. But now, thankfully, those days are over. So VA, and I'm talking about VHA and VBA in particular, of the two of the three, are working together to ensure that you understand your benefits. How can we ensure that you know how to apply for benefits and receive treatment? The new law, which many of you hear, many of you see it on Facebook, many of you see it on TV, is called the PACT Act. And that just expanded VA healthcare and benefits for millions of veterans, and not just veterans that are living, but their survivors, including many Vietnam vets, Gulf War, post 9/11 vets. Here's what all the veterans and survivors need to know. So this is what you need to know. First, we at VA want you to apply for PACT Act benefits and care right now. If you're not here getting your care, I want you to get your care here in Albany. Sometimes you don't recognize people with the mask. Glenn is a past employee who was our chief of engineering years ago. So we want you to get your care here. Best care anywhere. Second, VA will begin processing most of the PACT Act related benefit claims. When I talk VA, it's the VBA, the Veterans Benefits, that does the claims. On January 1, the earliest date possible. And if you apply for PACT Act related benefits before August 10th, which of next year, then your benefits will be backdated to August 10th, 2022. So that's why we want you to get your claims in. We want you to do this as soon as possible. Third, some veterans are worried that applying for PACT Act benefits will impact their current benefits. But the truth is this, it's different. If you file a claim, there's a 97% chance that your benefits will either increase or stay the same. So it won't decrease. That's not what is planning on happening. It's either to increase your benefits or in some cases will remain the same because you may already be getting that. So don't worry and don't wait. That's why they're here today if you want to look into applying. The fourth thing, there are people out there who will try to convince you that you need to pay someone to do this for you. You don't. I know how many on Facebook see that, the lawyers and all of that. You see it, right? I'm like, wait a second, why are they going to charge or take a percentage of what you deserve and what you have earned? You do not need to do that. They, and in some cases, I'm sure that others are benefiting from them, and I don't want to stop. That's a choice that you make. But you don't need that. Applying for PACT Act benefits is free. It's easy, and you can do it by working directly with the VA or veteran service organizations such as the VFW that we have in the back and other VSOs in your state or in your county. And fifth, you can learn more about the PACT Act here. You can learn about it online. You can learn it by calling a 1-800 number. So today's the intent of today is so that you understand that these benefits are here for you. You can apply today, and we will get you the benefits that you deserve through VBA. The hospital, VHA, Veterans Hospital, doesn't give you the benefits. Benefits are given by VBA. What can we do? We can give you the health care that you have earned and you deserve. The health care is a full gamut of health care: medical, surgical, mental health, social work services that are available. So, in a nutshell, that's what today is about. This is just as I said in the very beginning. We're going to do many of these so we can reach out. Please tell your friends, tell your colleagues, tell others that they need to come to the VA, and we can, through our business office that is also here today, we can enroll you if you're not enrolled. We can determine the benefits that you receive. So this is, as I talked about earlier, I do want to extend an appreciation to a few people. You know, you see a lot of people in this room, and I talked earlier to the new employees that these are the people that pack our parachute. They pack yours as well. They want you to have a safe landing. They want you to get what you need. So thanks to Sean Tuckey. I don't know where Sean is. He's over here, Sean Tuckey, who is a social worker, by the way. He's also works in my office as a health system specialist. We call Sean the man who can do it all. So his
phone number? I'll give you my card.
To my left is Peter Potter. Many of you know Peter Potter is our public affairs officer. Peter is probably one of the best in the country as a public affairs officer. He's out there reaching out to our veterans using some of the newest technology called geofencing that he could talk about earlier. But it's a way in which, you know, when you pass a store that you visited and all of a sudden you have an email message from them, this is a way that we can do this to reach more veterans. So we're always looking at ways. Peter's ingenuity and his ability to contact veterans. Our own Associate Director, Mr. Richard Lobriel, who is a veteran, and who worked on this group as well. Dr. Pellerin, who is our assistant, our assistant chief of staff. He's not here today, but he is over at the medical center making sure everything runs. Those individuals really worked well together to make today possible. Finally, I want to thank Emil Edel. Is he here?
No, he's not.
No, he's not. But a veteran that works very close with us, who has also, because of his story about hypertension and some of the exposures that he has, is now taking part, and he allowed us to be able to share that with you, allowed us to tell you that he is now getting his benefits, and he's also working with the VA to help him through his serious issues. So we're proud of what we're doing today. We're here to answer any questions, and we're here to support you. Peter?
Okay, I'm just going to reiterate a couple things the director said. We have our enrollment person in the back center, so if you need to do an enrollment, please bother him. Take up as much of his time as you possibly can. And we have our VBA representative here if you want to put in for benefits. Again, PACT Act is already underway. The director mentioned Emil Baker. He finally came to the VA after 30 years. He always wanted to save it for a veteran who could use it more. Now that he gets his care for Agent Orange exposure, he sits there and he goes to many of the New York State active duty stations and tells them not to be stupid, to get into VA, to claim their services. And let's face it, we're a government agency. When we get more patients, we get more money in our budget to serve more veterans, which means more doctors, more nurses. So it provides us the ability to provide more services. So you're helping out veterans by actually getting your care here. And he actually put in for PACT Act, and his hypertension gave him additional benefits on top of what he was getting for his Agent Orange exposure. So very, very important. Please don't let it go. Please don't save it for somebody else. because you're not saving it for anybody. This is really helping. And of course, we've got a lot of informational tables, so a lot of information of what services are available to you. Please take advantage of those. If you follow along, I've got some notes that I'll be reading from, but the slides will have a little bit different information. It's definitely going to be good. We will be posting on Facebook and providing it in some other available avenues as well. So if you saw some of our postings for this thing, please keep an eye out, and we'll have this same presentation posted. Okay, so the very first slide. Oh, sorry. That's okay.
Here, we didn't talk this through. I think you're gonna hit the button.
Oh, me? Was it just the arrows? Oh, the page down? Oh,
Freeze?
it froze. Oh, there we go.
Oh, so just the space.
Just a space bar? Okay.
I don't think, I'll try it over here. I don't think it's the one.
Okay, so today's town hall is to provide an overview of the PACT Act and how it expands and enhances VA's health care and benefits eligibility for veterans. We'll review what it covers, including information such as definitions of exposures, eligibility changes, screening, research, presumptives, and service connection changes. However, the most important thing to know is that every veteran already enrolled at VA will be screened, as well as every veteran interested in enrolling in VA care. I had an appointment this morning. They already gave me screening questions, so you will see if you're enrolled in VA care, your primary care team will go over if you've had toxic exposures and provide you information of where to go to get more information and care. Okay, so what is the PACT Act? The PACT Act is a new law signed by the President on August 10th, 2022. That's why everything will revert back to when the bill was signed, if you put in for a claim. It's one of the largest benefit expansions in VA history, likely to impact several million veterans. The law expands benefits and care to generations of veterans exposed to toxic substances and their survivors. That's an important piece, and their survivors.
Here.
Yes?
Yeah. So August 10 is an important day because it doesn't matter on the first year, from that day, on the first year, it's gonna be retroactively start back to August 10. But after the first year, when you apply for benefits, then it's from the day that you apply to the benefits. Does that make sense to everybody?
Yeah.
And also, if you happen to have a claim that's in that happens to be before the PACT Act paid, that'll also be taken into account. So that's the one nice thing about putting your claims in as soon as you possibly can, because it kind of starts the clock then.
Here, can I add one last thing?
Yeah.
The other thing with claims is, if you don't apply or you don't submit your claims, or your friends, families, brothers, sisters, father, we all know a veteran, right? If we don't submit a claim, they will never know whether or not they qualify. So it is imperative that the claims are submitted, okay? The system is designed not to deny claims, but to help veterans get the health care benefits that they deserve, okay?
And it's also important to note that even if you have been denied in the past, it doesn't mean that you're going to be denied in the future. Laws are always changing. I mean, we're at the behest of Congress and the President, so when these laws change, it's nice that you already have an application in. VA remains committed to ensuring all veterans and their family members receive the benefits and care they have earned and deserve. The new law includes the tools and resources to ensure VA can effectively implement and meet the growing needs of veterans today and in the future. First, we'll review some of the items you'll hear in describing veterans' exposures. Military environmental exposure is a broad term that includes exposures to a wide variety of agents, including nuclear, biological, chemical, and physical. That's an important one to add in there. And the physical is such things as sound, vibrations, noise, and x-rays. I'm sure you've heard that in the news of recent. They're all part of the military environment, both deployed and in garrison. Military environmental agents have the potential to cause adverse health effects, either alone or in combination. Now, toxic exposure refers to a subset of the military environmental exposure. Being toxic is determined by the substance, the concentration of exposure, the route of exposure, which could be inhalation, ingestion, transdermal or intradermal, intravenous, any kind of thing that the doctor may see as possible transmission, and the duration of the exposure. The PACT Act defines the term toxic exposure, but as a general matter, there are several types of possible exposures or hazards veterans may have experienced during the military. So if you don't happen to see it listed, doesn't mean that it's not going to be covered. Some of the more common exposures include those of chemicals, air pollutants, occupational hazards, radiation, and warfare agents. This new law addresses a range of issues impacting toxic exposed veterans, including access to benefits and health care provided by VA. VA will create a list of specific exposures, and those lists in the table are some of the examples of what may be included in the list. But again, we're a constantly growing entity. We're going to constantly update this list, and you'll find it either on our website or in information that we provide. The PACT Act helps advance one of VA's top priorities, getting more veterans into VA by expanding eligibility and available health care services for veterans exposed to toxic substances. Section 103 of the law requires VA to provide hospital care, medical services, and nursing home care for any illness to 3 new categories of veterans, as well as additional benefits. So Category 1 are veterans who participated in a toxic exposure risk activity while serving on active duty for training, or inactive duty training. Category 2 are veterans who were assigned to a duty station in and including airspace above Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates on or after August 2nd, 1990. During the active service on veterans who were assigned to a duty station in Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any of the other emails. Assigned to a duty station determined relevant to the VA on or after September 11th, 2001 during active service. And then there's Category 3, veterans who were deployed in in support of the Operation Enduring Freedom, Operations Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operations Inherent Resolve, and Resolute Support Missions. Now there's a lot of different names, there's a lot of different classifications. I'm a Navy guy, so I like to simplify it, especially for my Marine brethren. Sorry, I had to throw that out there. Look, you go in and you talk to the people who are exposed to this information on a daily basis. They're going to be able to give you the most updated information.
Yeah, I think it's important to recognize that you should not be trying to break your heads and trying to figure out whether or not you qualify. The important thing is that you come to the VA, the VHA or VBA, and start the process. This is just a small sample of the possible scenarios and possible places, but we all know in the military we go everywhere, even if it's for 1 day. This portion doesn't have a time limit. 1 day is enough, an hour is enough. Okay, so we just need you to come in, file the claim, and we'll take care of the rest of that.
Now, certainly if a veteran has an issue, they can always receive care, as usual. There's a lot of specific dates, and based on your individual services, we can help narrow it down for you in determining the category and what best fits your service. We'll take a moment at this slide for you to, so you can see the various discharge dates and eligibility categories. Again, the most important thing is, like Chino and I have already said, is get in, connect with the VA, connect with your benefits. That's the key. You know what, I'm gonna read through this because we're gonna be providing this on a taped version. So, veterans identified in category 1 and 2 will be eligible. These are veterans on October 1 of 2024 that they'll be going through the system who were discharged or released between August 2nd, 1990 and September 11th, 2001. On October 1st, 2026, veterans who were discharged or released between September 12th, 2001 and December 31st, 2006. And it goes on like this, and it's a way, we're figuring at VA, this is gonna be the second largest veteran enrollment section since Vietnam. So it's very important that we provide a staggered approach to be able to get the veterans who have the most need in as soon as possible. That doesn't stop the idea that we need to get you in as quickly as possible. From now, beginning October 1st, 2020, through October 1st of 2023, veterans who served on active duty in a theater of combat operations during a period of war after the Persian Gulf War, or in combat against a hostile force during a period of hostilities after November 11th, 1998, and who were discharged between September 11th, 2001 and October 1st of 2013 may receive care upon enrollment for VA healthcare. Enrollment is free, there are no annual costs, and your care may be free as well. And that's an important thing, because even if you're, with the enrollment costs for medications, if you're service connected especially, there are no costs, there are no co-pays. If you have an issue that's not service connected, the co-pays are so small, that it's definitely worth your effort. Again, the important thing is applying for enrollment. The PACT Act also provides services at specific locations. For instance, veterans who served in the following locations and time periods are also eligible to enroll for VA healthcare, effective on the enactment of this PACT Act. The Republic of Vietnam between 62 and 75, Thailand, or any of the U.S. Royal Thai bases between 62 and 76, Laos between 65 and 69, certain provinces in Cambodia between 69 and it's April 16th of 1969 and April 30th of 1969. Guam or America Samoa or their territorial waters between 62 and 80. And Johnston Atoll or a ship that called there between 72 and 77. So again, the important piece here is to know that it's not just time periods, it's also locations. The PACT Act also establishes presumptives of service connections for more than 20 conditions related to toxic exposures. And much like the Agent Orange presumptives, this automatically puts you in for VA care and enrollment qualification. Oh, you know what? Somebody was, for those taking pictures. VA will contact veterans when a presumptive of service connection is established or changed. You can learn more at www.va.gov/PACT, P-A-C-T. That's your internet source. That's always going to be updated. It's a great website to have at your for your use. Veterans who were previously denied a toxic exposure-related claim are encouraged to file a supplemental claim using VA Form 200995, which is the Decision Review Request Supplemental Claim. Most claims that were previously denied will not be automatically reviewed under the PACT Act. Survivors who were previously denied dependency and indemnity compensation related to any of the new presumptive conditions are likewise encouraged to refile a claim. Veterans who have not previously filed a claim and are diagnosed with one of the new presumptive conditions and meet eligibility requirements should submit a new claim on VA Form 21526EZ, Application for Disability Compensation and Related Compensation Benefits, Survivors who have not previously filed a claim and meet eligibility requirements should submit a new claim on the VA Form 21P 534EZ application and survivor pensions and or accrued benefits. Veterans should be prepared to submit any supportive medical and lay evidence along with their claims. So basically like any claim. Separate from the PACT Act, the Dr. Kate Hendricks Thomas Supporting Expanded Review for Veterans in Combat Environments, it's called the Service Act, also expands the toxic exposure eligibility for veterans who served overseas. Signed into law on June 7th of 2022, the Service Act expands eligibility for clinically appropriate mammography screening for veterans of any age who served in certain locations, not including bodies of water or airspace above. On this slide are the locations and periods of service. The Service Act does not change healthcare enrollment or claims and benefits application requirements. There's also the Camp Lejeune Act. So again, there's a lot of support coming from VA that makes it even more important to definitely get in there and apply. As of now, every enrolled veteran will receive an initial toxic exposure screening and a follow-up at least once every 5 years. Veterans not enrolled who meet eligibility requirements will have an opportunity to enroll and receive a screening. Veterans will be asked questions about potential exposures to an open burn pit or other hazardous commonly associated with military environmental exposures. VA healthcare providers and claims processors will receive additional training and education on toxic-related exposures. Details on training for healthcare personnel are still in development. VA will also be publishing a list of resources for toxic exposed veterans and veterans who report toxic exposures. And the screening is fairly easy. I went to an appointment this morning, like I said earlier, answered a couple questions, the screening was set, and it's very easy. It's not a long process. You shouldn't be scared of it or worried about it. Another important role of the PACT Act is that it strengthens VA's ongoing efforts to collaborate with other federal agencies through creation of an interagency working group on toxic exposure research. The work group will be led by VA and comprised of DoD, Health and Human Services, Environmental Protection Agency, and other federal agencies. It will identify collaborative research activities and will develop a 5-year strategic research plan. Among the other requirements, the PACT Act has authorized studies on mortality of veterans who served in the Southwest Asia during Gulf War, post 9/11 veterans health trends, veterans cancer rates, effects of toxic exposure and mental health outcomes, effects of waste related to the Manhattan Project, the state of access and barriers to benefits for veterans in U.S. territories, and effects of jet fuels. VA, which includes the VHA, that's us, the hospital, and VBA for our benefits, continue to work on implementing plans and will provide additional information as it comes available. In the meantime, I encourage you and others to go to VA's dedicated website. That's the www.va.gov/PACT, P-A-C-T, to learn more. That's the second time I've read this, only because it's an important website, it's important information for you. We will continue to outreach to our veterans and their families for the next several years. Of course, one of the most effective and strongest communication tools we have are veterans and their families. So in closing, we ask that you help us spread the word. Tell your friends, family, anyone you can about the care and benefits available at VA and how important it is to enroll. Even if they've tried before or may have been denied, this is the perfect time to try again. Whether the addition of new presumptive conditions or a change in eligibility, it's definitely worth the effort. I might share one last story before I shut my trap. One other important reason why it's important to enroll as soon as possible. I got out in 91. A fellow veteran that I met here after starting to work here got out at the same time. I was, well, in the Navy, they ingrain it into you to check into the VA and complain about everything. Any little pain. That's us Navy folks. You know, they want to make sure that you're covered. He happened to be in the Army. You know, unfortunately, the Army is one and done. They want to get you out, and they've got the next crew that they're training. So he signed up for VA, which was great, but he didn't use the services in the 3-year time limit. So what happens when that happens? You kind of get kicked out of the system because we don't know what's happened. We don't know if you've moved to another location. VA just doesn't have tracks, and we suggest an appointment at least once a year, but certainly once every 2 years is good. But once 3 years comes along, you get knocked out of the system. Well, 8 years goes down the road. Now all of a sudden he has issues, probably based off of toxic exposures. So he calls my office and says, hey, listen, we served at the same time. I remember you from the last time. And how do I get in to get care? Well, Congress had changed the rules. He was no longer eligible. As a veteran, that really hurts. As a healthcare institution, that hurts to hear that a veteran who was able to get care now is no longer able to get it. So what we say at VA is, look, you gotta put in for it. You gotta use that eligibility because you never know when the rules will change. I work at VA. I probably wouldn't meet the eligibility threshold except for my service connection, but I'm grandfathered in because I enrolled at a time when they were accepting veterans. So I get all my care at the VA, even though I have a choice to go outside. And you know what? If you want to keep your private doctors, I hear that as well, you can, because VA does co-managed care. So I do have a couple private doctors that I see on the outside, but I see my VA as my primary care and my specialty care. So really important message. I mean, that's you know, I walk the walk. I don't like just talking it. So the importance of enrolling. And anybody that you talk to, just try to engrave that. Hit them with a hammer if you have to. Don't hit them with a hammer, that's liability case there. But get them to come and enroll. Is there any questions?